Is there something in particular that you can point to, maybe one or two things that traditional medicine can't offer that naturopathic medicine does?
Yeah. Yeah. I think that's there's like two parts to that question. So one is like in the kind of outline of how the appointments work. And then the other is like in the things that we actually use. So the biggest thing is like we have time. That's the biggest difference between Western medicine and naturopathic doctors. I always say, like, your family doctor wants to have more time with you. It's a broken system. I mean, I personally don't want to be part of that system. We always get that question, like, do you want to be part of OHIP? Like, no, I like the structure of my things. The other great thing is because we are like trained in so many different areas, naturopaths work really well to like bring it all together for you. So if you're seeing your family doctor, maybe you have some blood work or some medication or some recommendations. Maybe you've been sent to a specialist. Maybe you're also seeing like a physio. I can kind of sit down and say, okay, I have great knowledge in like all of those areas. I can read your reports. I can tell you what to ask for or what it even means. Like I spend a lot of time with patients being like, okay, they say, I've got this diagnosis. It freaked me out. I don't know what it's like. I've got this medication. Naturopaths are fully trained in medications and pharmacology. So even though we have like a really tiny in Ontario prescribing window of like what we can prescribe. Other states and provinces are different, but I know how it all works. I know, what drugs are used when, how they're supposed to be used. And so it really can be this like one person that can like put it all together for you, which I think is so helpful. We also have access to more testing than family doctors do, again, because of the system. So they actually can't run some tests. So people will be like, I really want to run XYZ. And it's like, well, they're not really allowed to. They will get flagged and they will get in trouble. So we can run it. You just have to pay for it. It's
They're
a
not allowed
really
to. For what reason do you think? Is it because it puts a burden on an already stressed system? Is it because there's just not enough time or resources to do that? Or why are
yeah,
they not allowed?
yeah, it's like because they will get flagged by OHIP being like, why are you running these tests? It's not kind of part of your algorithm. Like and or it doesn't change their treatment. So sometimes they don't have other treatment options. So thyroid's a really great example. They often run something called TSH. Maybe they run T4. There's like three or four other thyroid tests they can run. The antibodies, T3, it doesn't matter to them. If your antibodies are high, your treatment is still the same. So there's no need for it. Where naturopathically, actually, the treatment's quite different. And we can, find those nuances in herbs and vitamins and things like that with different testing. We can also look at it a little more specifically. So we can look at optimal ranges versus normal ranges. What's really interesting is how they create normal reference ranges is they like take the population and they say if everyone's iron, is around this, then that's normal. And that's not maybe optimal because maybe everyone actually just has low whatever or high whatever. So we can like narrow those a little bit. The other thing that's kind of cool is because naturopaths can be a little bit more, we're not allowed to use the word specialized, but a little more focused in their targets. They can be a little more up to date on like new research or new things that people are trying. Where I always say your family doctor is seeing people from the age of 0 to like 100. They can't be on top of every new study that comes out. They're going to be on top of recommendations, but it takes, I think, on average, something like 7 or 8 years for something to be figured out in a research paper to become a standardized recommendation for the general population.
One thing that really resonated with me in terms of what you were saying, and I think would resonate with a lot of people, especially in Canada. I'm not sure about other systems, but
Mhm.
um, seeing a doctor is not always easy. It's not always
Mhm.
easy to get in to see a doctor, especially if you don't have like a given family doctor. And
Yeah.
then when you do get in to see them, often it's a very quick meeting. Heaven forbid you have to go to a specialist. It's like they'll see you for 15 seconds.
Yeah.
The ability for a naturopath to take the time, I think, is a nice additional factor. But I'm going to have some listeners who are going to be skeptics about naturopathy,
Yeah,
and I
totally.
wonder, what would you say to them, and how would you bring them over to at least see your perspective?
Yeah, I think there's a few pieces there. Like when I kind of just to backtrack, like what naturopaths actually do. So everyone's a bit different, and modalities isn't a word people are that familiar with, but modalities are just like the different areas of treatments that we do. So, for example, supplements or nutrition is a modality, and acupuncture is a modality, and hydrotherapy is a modality, whatever that is. So, naturopaths at the end of the day are evidence based. What evidence based actually means. So, evidence based is a pyramid. If you Google this, evidence based medicine, and we look at like how we like hierarchy different things. So, if something's been used for tens of thousands of years, we might not need a giant, randomized controlled trial of a million people to tell us that it works. We just know that. We can use case studies, which again, that might not be on PubMed in a research study, but someone might say, "Hey, in my patient, I've used X and we've seen this." We can look at observational studies, which are we looked at the general population. We saw that people who, eat more fruits and vegetables had higher nutrient levels, and then we can do randomized controlled trials. Problem with randomized controlled trials is they cost money, and you can't trademark vitamins. You can't trademark herbs. So there are just less, funds for a lot of those studies. So they're getting better. The types of studies they're doing are getting better. There's some really cool like naturopathic studies that they've done in the last few years where they'll be like, here are 10 things that are good for diabetes. You're going to take your patient and you're going to choose which ones are best for them. So everyone has like this kind of thing they can choose from, but it does get individualized because that's kind of the perk of naturopathic medicine is it can be individualized. So yeah, there's definitely evidence for what we do. It might not always look the same. And at the end of the day, like, I don't know. I always think like if it works, it works. The number one, a lot of people come in, they go, I don't know if it helped. I like changed all these things you told me to change, but I don't know if it helped. It probably was just placebo. Well, first of all, placebo has an over 30% chance of working. So if it's a low cost intervention and it has no side effects and it's just a placebo, great, you feel better. But also like it probably had some impact. There's never like one thing that's going to be the solution.